who's the Director of EMS coverage, EMS services in Madison County, and to my right, far right, Travis Du Bois, Town of Hamilton representative to the board, to the SOMAC board. So at this point, I'm going to turn the meeting over to Paul Bishop, who's going to present the strategic study and moderate the rest of this evening's meeting. We will have plenty of time for audience members to ask questions of any of those up here in front. And also, this whole meeting is being broadcast, so I don't know how we're going to take your questions. Maybe we're going to bring Okay, so we're going to ask people to come forward. Thanks, Morgan. So that your questions and answers will be shared with other members of the community, and this is going to be recorded, so it'll be available tomorrow, and it's available live tonight. So hopefully, folks who weren't able to come tonight to the meeting will still be able to hear the overall presentation and get a sense of where we're headed. So I think the most important thing to remember here tonight is I'm gonna slightly steal a little bit of Paul's thunder. We are not alone in this community. Our community is confronting this problem. The same problem is happening all across New York State, all across the United States. So we're not alone, and we are not to blame for the fact that our local ambulance service has had tremendous difficulties. There are huge factors, national, financial, labor, operational factors that just impact all services. And so that's a very important takeaway. And the other really important takeaway is your calls will be answered. They're being answered today and tomorrow and for the foreseeable future, and they're going to be answered very, very well. So there's no need for physical or emotional concern in terms of this. We have emergency services covered for our communities. And the question is just, how is that going to be covered, and which we're going to talk about tonight. So thank you. I'll turn this over to Paul.
Thank you. All right, we have the presentation that's going to be running behind us. Again, my name is Paul Bishop. I'm a principal with CGR, the Center for Governmental Research. We're a nonprofit private research firm based in Rochester, New York. It's been working with local governments for 108 years. I've been with them for the last 12 years, doing projects with local governments, helping people find better ways to serve their community. The last 5 years, we have been answering questions and concerns about how EMS operates and how it can best serve the communities really throughout New York State. Right now, I have active projects going on in a half-dozen communities in New York, as everyone is facing these same challenges that you ran into and you've been dealing with in your community. And I have a little bit of experience with it, having being a 27-year paramedic. I continue to work in the community where I live, and we have been going through our own changes as we have come from an era where EMS was primarily provided by volunteers to increasingly, we've been dealing with having paid staff and the consolidation of ambulance services. So this is a trend that we're seeing really across the state and across the country. We can advance the slide. We're going to talk a little bit about the project that we began and how it changed as we moved through it. So CGR was engaged in May. We conducted a number of interviews, virtual and in person. We had a site visit, we came into the community. Really our goal was to get to know how SOMAC operates, how it interacts with the community, and try and develop a plan for it going forward. We had interviews and data requests from SOMAC, from Madison County, New York State Department of Health, gathering a lot of information, objective information about how things are operating. And we reviewed information from similar agencies. We developed what we termed a SWOT analysis: strengths, weaknesses, opportunities, and threats. We considered different options, and while this was going on, events were changing on the ground. The circumstances of how SOMAC was operating were really shifting as we were going through the project. And what has happened is Madison County EMS was able to begin operating full-time in Hamilton starting last Friday, and SOMAC has stopped answering the 911 calls, but it was a relatively seamless transition, really given the speed with which things changed on the ground. And we're trying to identify really what that plan is for things going forward. Can you advance to the next slide? So what did we find out as we were working through this project? There were really strong relationships between the community members. The partners that are sitting up here and are represented by the folks who are to my left and my right, and others in the community, there is a strong desire to make sure everyone is getting good care and service in the community, and people working very well together. But despite those best efforts, there were some demands, some stressors on SOMAC that were really difficult to overcome. There's an increase in demand for services, and we were seeing that reliance on paid staff. There is significant competition for EMS staff. EMTs and paramedics, in the scheme of things, are relatively poorly compensated. And when you have competition for that workforce, and there's a relatively transferable skill. They can take that EMT card and they go from one community to another, not even neighboring communities. They can move across country if they want to. So keeping hold of an EMT or a paramedic is challenging. You need to have the right working environment. We found the financial deficits for SOMAC, and we have some graphs that we'll show you in a couple slides that really how that progressed over the last few years. Despite the best efforts of those in the community to control costs and manage how they were operating. There's some concerns about the facilities at the SOMAC base. We also heard very loud and clear from the Colgate students and members of the Colgate University community how valuable the experience that their students felt that there was being at SOMAC. They had about 40 to 50 volunteers, student volunteers, who were going through and supporting the community and also developing their own skills as part of the experience at SOMAC. And we also learned that the operational leadership at SOMAC was taxed. It was a really small group of people who were trying to operate a $1 million business 24/7, and really with a lot of stressors coming at them from every direction. Next slide. So what happened with that increased demand in service? We went back about 3.5 years, and the total number of calls has increased significantly. So in 2020, it was about 2.5 calls a day, and in 2022, it was 3.2, and it was at that same rate, that 3.1, when we were looking at the data halfway through 2023. So that increase of roughly a 50%, or the additional 1 call a day, really began to tax the system, and some of those calls were long calls. So what was happening is there were the interfacility transports that were taking patients from Community Memorial Hospital up to Syracuse or Utica, and those calls, instead of being roughly an hour long, which is what a transport to Community Memorial would be, were turning into 2- and 3-hour long calls, and that was taxing the staff. They were having to and trying to call in additional resources to ensure that we were having good coverage in the community. There was an increase in the transfers that were going on in the facility, in the community. Really the jump in 2021 and 22 was they were trying to meet that with additional staff, having people on call, but it wasn't enough, and they weren't generating enough revenue off of those transports to meet the increased demand. You can advance to the next one. So this graph didn't translate well from PowerPoint to the Google program here, so it's a little sloppy up on the screen behind me. But what we see from 2019 through 2022 is the expenses increased from about $576,000 to $975,000. And that increase in expense was heavily driven by adding additional staff to handle the additional call volume. And the hope was handling that additional call volume would bring in the revenue, because that's how ambulances are hoping to be able to make revenue off of transports. And it wasn't enough, because the line below, the gray line below, we're seeing that income going from $381,000 in 2019, and that jumped up to $570 in 2022, but that obviously isn't the same increase, that same rate of increase that we were seeing with the expenses. And what was covering that gap was subsidy from the towns of Lebanon and Hamilton. Go to the next one. So when we talk about the drivers of the deficits, it was really the payroll expenses. They rose 70% in a 4-year time frame. And the intent, the hope was that they were going to be able to increase the revenue on interfacility transports that was going to help meet that increase in demand. But it just was not able to do it. And we're looking at those lines. The EMT and the paramedic are the green and the red line behind me, and those both went up kind of in parallel as they were adding staff during that time. They were also increasing the pay rates in an attempt to retain employees and keep them from going from one community to another. So in addition to putting more hours on the road, they were having to increase the rate to be able to keep people staying here, because as I said, that position, that EMT paramedic card allows you to work in a lot of different places. You also had increases for vehicle maintenance and repair, jumped up 93% during that same 4-year time frame. And the cost of fuel increased 135%. So that same cost that you're seeing as a consumer with your car, think of the miles per gallon on an ambulance, and particularly when they were picking up these interfacility transports, taking patients across New York State, that was really driving up one of their big lines. You can go to the next slide. So, taking a look at the income, when we talk about how ambulance services get paid, they're primarily a fee-for-service enterprise. So when they transport a patient to the hospital, they seek reimbursement payment from insurance companies. And the insurers, the primary insurers that SOMAC dealt with were Medicare and Medicaid, which combined were 69% of the patients. And they are the two lowest reimbursement rates. In fact, Medicaid pays roughly half, about 60% of what Medicare pays. And Medicare pays less than what a commercial insurance pays. So with those two, Medicare and Medicaid being the primary patient drivers, they were struggling to bring in that revenue. Every transport, they were averaging about $577 in revenue for an ambulance transport. And so you figure that, and they were transporting, we'll call it about 2 patients a day, because although that they had 3 calls per day, they're only transporting about 2/3 of those. So they're really only bringing in about $1,200 to $1,500 a day in revenue, and their expenses were more than that. They were in a structural deficit. And this is something that we see when we look at EMS systems, that you need to have a certain amount of well-paid transports in order to fund your staffing model with paid staff. The only other way to make that up is to have active volunteers that are able to answer the calls and fill the shifts. And they do have that, they did at SOMAC with the students during certain times of the year, but other than the students, SOMAC had effectively 0 volunteers, 1 or 2. So it's not a lot of community-based volunteers in the year 2023. Go back a decade, that was a much higher number. And that was part of what was driving this. They were having to fill those shifts with paid staff. And the interfacility transports, there was a thought that they were going to be able to make enough money with the longer distance interfacility transports to make it worthwhile for them to go marketing and encouraging nearby hospitals, not just Community Memorial, but Norwich and some other hospitals in the area, to use them, that they would bring in enough money that would help bring up that bottom line. But that modeling really didn't pan out. But it was a good effort, a valiant effort to bring in the additional revenue. And then, next slide. So we met with the SOMAC board, and first we met with an advisory committee, and then the SOMAC board in late August, early September. And we had identified that there were some immediate decisions they had to make. And one of the first things that we said was good EMS coverage in this community is not dependent on SOMAC. There were other alternatives, including Madison County EMS. You need to understand, and the towns really needed to be able to commit as to how much they were willing to support going forward in order for SOMAC for them to do the planning and for them to really try and fix their staffing problem that they were facing at the end of the summer. EMS is an essential service that was supported by volunteers and calls for service fees in the past. But with that drop in volunteers and the payments not keeping pace with the cost of, with inflation and the increased cost of staff, they were in that structural deficit that we pointed out earlier. So that current scenario does not either have enough calls or enough volunteers to be sustainable. More of either would help, but they didn't have enough. And they were so short-staffed at that point. They had a number of full-time employees that had made career changes. They had people who went back to nursing school. They had people who had taken full-time positions out of the area, and they had people who had become full-time firefighters. So when you had a full-time staff of ideally 8, they had 6 when we started in May, and they were down to about 3 by the end of August. They needed to hire 4 full-time staff in order to keep the doors open at the end of August. And the decision was made at that point in time that they were going to look to transition to Madison County EMS by January 1st. So that was the decision that was made in early September. So where are we now here in the middle of November? Can you get the next slide? Jenna's checking for me, thank you. You can continue to expect high quality EMS when you call 911. SOMAC is providing an excellent service. Madison County EMS is going to provide an excellent service. They already are. They became a primary provider on Friday. Madison County EMS, and Jenna can speak more to this in a minute, but they started with an ALS ambulance, which was the same level of service that you had previously, 24/7. That's what your in the community availability is. And there's the intent to begin to add additional unit hours or additional staff to help with interfacility and the call volume going forward, but it takes some time to get the physical equipment and the people, so that's really looking like a January 1st start. The Colgate Student EMS program is going to continue under the county's umbrella. That's valuable to the community. They provide volunteer service to the community. They learn as well, and it provides them service or a skill that they can take elsewhere. And the plan is for them to be able to continue to operate an ambulance independently going forward. So that is still going to be a benefit for the community. Next slide, please. Madison County EMS is going to continue to provide the standby services to Colgate, and the Colgate students will be doing that as well with the Madison County ambulance. The cost for EMS service in the town budgets will be substantially reduced as Madison County EMS operations is funded through the general operating fund of the county and the interfacility, the patient transports. So the patient transports, and they'll have that same number plus money from the county general operating funds. Madison County EMS, instead of being overseen by your 2 town boards and their own individual board of trustees, how SOMAC does it, they're overseen by the board of supervisors. Your town supervisors sit on that board, and they have the ability to get involved in that process. And then the intent, as we sit here right now, is that SOMAC is going to dissolve. They're an independent nonprofit, a 501c3. That process is governed by the Attorney General. They're in communication with an attorney to help them develop a plan and present it to the Attorney General for the distribution of assets. The initial plan is to transfer most assets to the county to help support the EMS service that is going to be delivered in the community. And there's also a plan to celebrate and acknowledge the many years of dedication of SOMAC and the community volunteers. So this is a service that did a lot for this community. And we want to recognize them and thank them and realize that this is a change in how service is provided, but we want to honor what they have done in the past. So with that, that is my last slide, and we're going to move into some questions and answers, although I don't know if we're going to have anyone else speak first. You want to say anything? Okay.
I will say that I forgot to mention Colgate University's representative, Joanne Borfus, the VP for Vice President for Community Affairs, is here tonight, but Joanne Borfus is right there. But she said she's a little sick and didn't want to come down here and share with us. So she's here to answer questions if you have any questions. But I apologize for leaving you off, Joanne, but you weren't sitting here, so I forgot. That was good.
So we're here to answer questions. If anyone in the community has them, you can come down and use the microphones on either side.
I had a question.
Yes, sir.
Yes.
Can you?
Okay. Well.
So everybody will be able to hear you.
Ear, ears, and then over here. But can everyone hear me?
Yeah.
I hope. Okay.
The folks online probably can't, so you can just pick it up.
Can you take that? Okay. I was looking at the feasibility studies that you're obviously you're skilled in doing, and its focus was on SOMAC in this community.
Yes.
The problems that I'm hearing are symptomatic all over, and I feel those problems exist, even though we're making this transition into solving some immediate concerns. The problems remain, and my biggest question is, how long will it be before Madison County comes to grips with the same funding, the same personnel issues, all those same bullet points that you put up there? How long will it be before the projection of coverage has to change again, and the pot starts to run dry, and we go to a different level of coverage, maybe inter-county? I know we've talked how Oneida is looking at doing inter-county consolidation. Is this a problem that is just going to continue and we're going to face over and over again? And what we're doing is a damn good try to slow it down, but is it really the answer? I'm not sure. I've got my concerns for the future. So just my point of view and feasibility studies as far as what changes we can have in the next few years that are going to be necessitated by what I consider the bullet points of progress. You know? So that's it.
Thank you for your question. Your fear and your concern is something that has been brought to our attention before. So with a county system, the county has a more of a larger scale area for coverage. We also have a larger pot to pull from. So we are able to get more grant funding at a county level. And because this EMS service is under the emergency management umbrella, we have other opportunities for funding as well. So unfortunately, as a 501c3, you have very minimal options for grant funding and other types of funding. But at county level, we have different types of funding mechanisms available to us. And that doesn't mean that your taxes are going to go up every single year because we have an EMS program. That means that we're going to find other avenues of funding that will be more readily available to us at the county level that are easier for us to obtain as well. And there's probably going to be some times where it's going to be, well, how are we going to make this happen? How are we going to fund this? But I can promise you that after sitting through months of board meetings with our county supervisors, they feel that EMS is an essential service here in Madison County, and that's something that's not going to go away. We are going to continue to provide good quality EMS service 24/7 to the residents of this county, and however we have to make that happen, that's how we're going to make that happen.
I just want to add, this is something all across New York State we're looking at, how to develop the workforce, how to recruit and retain people into this very valuable line of work. And Jenna didn't mention it in a lot of depth, but the county has lower administrative costs per call than SOMAC had. They're going to be able to bill for service at a slightly lower price point. They have their supervisory span of control is different. So instead of having one manager operating one ambulance, they have one manager handling several ambulance bases. So it changes, and that price point is going to be lower to be able to handle those operations. So it is going to be a more sustainable model.
Yeah, I would only add, in terms of employees' retention, the fact that the county is part of the New York State retirement system and the health insurance that is available through the county is really an additional benefit that really will help us retain employees. It's a good job. And the program, Jenna's program, is also committed to education. So we're going to be investing a lot of funds in developing more EMTs and paramedics. So they're working with young people, young kids in high school to get them interested. There's a lot of different programs. I don't even know what they all are, but I do know that we will be trying to grow our own staff from within our county. So I am not as worried. I have a lot of confidence, and I would reiterate what Jenna said, that our board, the Board of Supervisors today, coming from 19 people, coming from across the county, from big towns and small city, they all understand that this is an absolute vital service, and they will stand behind it financially, and hopefully there will be some economies of scale, just sheer numbers of calls. So some of this, the county's already providing service in the town of Sullivan. That area has a greater call volume that is allowing the service to generate a small, positive. So that will get put back in to help cover SOMAC's deficit. So there's a lot of different ways to look at why this will be more successful, I believe.
We're here to answer your questions. You're all here.
I don't have a question. I have a couple of thank yous that are owed to this board right here. My name is Luke Dowsland. I am the fire chief in Hubbardsville. This is a result of hundreds and hundreds and hundreds of hours from all of these people putting in work in this, right? Am I wrong in that? 37 years SOMAC was here and provided a damn good service for us. Everybody here. So thank you for not interrupting any service. We have ran numerous calls with the county. It's been great. We have nothing to worry about here. Brings me to my next topic. There's a lot of people in this room that are obviously concerned about EMS, right? This is an opportunity for all of us to open our eyes and say, what can we do to help this service? What can every single person in this room do to ensure EMS continues in this town? We all have the same opportunity to take these EMT classes. Come, take them, help out, so this problem never has to happen again. Thank you.
You've got a class starting in December, right?
There's a class in Hubbardsville starting in January. I hope to see all of you there.
I came thinking I was going to have a lot of questions, and I'm very thankful that I don't. I thought the PowerPoint laid everything out extremely well. And secondly, I had to call. I was in a car accident shortly after we moved here. We were only been here 4 years, and I was pretty close to the ambulance, but the care was fabulous. I mean, extremely efficient, kind, and calming. So I think we should all owe greatly to that. Second is on the PowerPoint. I was an emergency room nurse a long time ago. My question is, for making transports Is there a division between an emergency transport and going to a nursing home, and is the cost, as I remember, they're two separate things. So in a small town, emergency as opposed to bringing everybody to nursing home, how is that figured in when you're going to do budget-wise?
So I drastically oversimplified all the insurance.
Okay.
Yes, there are many different tiers of insurance, and I think more importantly for the call volume, that there's a difference in what happens when you call for an ambulance. So depending on the severity of the patient, they might get an immediate response over to the hospital to pick them up and then get them over where they need to be. And if it is, as you said, maybe a discharge to a nursing home, it might be something that's scheduled and they would wait till the next morning, and the pay is different as well.
So in transporting, you've got your ALS ambulance, but your transport to a nursing home, you could bring a little van, or is that within the system, or is there laws that say no upon transfer? I'm just thinking long-term money-wise, because this is elderly population here is more, so those transports may be a little bit less payment even.
So this focus was on ambulance service. We didn't get into the alternatives of a wheelchair van or an ambulette. Those are services that do sometimes get paid for as well.
And then one more question, sorry. When you're doing a trauma transfer, does the hospital send a nurse, or how is that worked out between the ambulance? Or is that the hospital decision, or will Madison County say, no, I only have one person here, I need a nurse, and does the community, are they able to send a nurse?
We're gonna let Heather answer, I think.
Gonna choke anybody? That was one of our questions too. So we've been in collaboration and communication very closely with Madison County. Those transfers that have to go quickly will be treated as 911 calls, not just inter-facility transports. So we will differentiate the level of acuity for the patients and how readily and how quickly they need to get from our hospital to a higher level of care. Because we are the gateway, we're a small critical access hospital. We rely heavily on our transports and getting our patients out quickly. And so for patients who have to go with a nurse, we coordinate that we've done that with ZOMAC. We'll do that with Madison County as well, and we often send nursing.
Okay,
Yeah.
I just wondered if that was going to be a new thing.
We
Yeah,
do it now, where I
okay,
don't
that's what
suspect that will change.
Okay.
So, yeah.
Thank you.
I'm going to make one quick comment about your question before. The only time a patient would be transferred from one facility to another by ambulance is if it's what we call medically necessary. If a patient can go by ambulette or a lower level, then they would. We won't take an ambulance to transport a patient, and obviously that's going to continue, I assume. We wouldn't take a patient that doesn't need an ambulance by ambulance.
Thank you for this panel, very informative. Evan, you touched on the town of Sullivan, Sullivan's experience is now part of Madison County. And I'm interested in knowing across the county how many other townships and villages and communities are in the same track or in having the same experience as Hamilton and Earlville, Lebanon, and in terms of this transition.
So that's an excellent question. We've been saying that EMS is kind of in crisis across New York State. Most of our county agencies are holding up quite well, actually. We are in the process at the county level of approving a budget line in our 2024 budget to help fund the current EMS agencies across Madison County. With SOMAC, we had 9 EMS agencies across Madison County. Without SOMAC, we'll have 8 Madison County EMS will be in 3 townships of those, but we also have 2 private for-profit ambulance agencies, and we have 2 municipal ambulance agencies, and the rest are all a combination not-for-profit ambulance agencies. And they're all doing the best job that they can do, and we can't thank them enough for the service that they're providing to Madison County. And we at the county level are trying to help them in any way, shape, or form that we can, whether that be funding or educational opportunities. All the leaders, we meet every other month on the 3rd Monday, and we discuss some of the needs and the things that the ambulance agencies of the county need. So we are working together in conjunction to be able to continue a good quality EMS service across Madison County.
Yeah, I would say that the financial funding that the county has agreed upon this year, the goal here is really to support those existing services so that they can thrive, they can survive. Many of them have more volunteers, many of them are in communities that have more calls. So they have just a better financial return because they just have higher population density. And so that really helps. So we're doing our best essentially to not expand Madison County EMS. That is not the goal of the county. The county does not have the goal of taking over. The county's goal is to try to support the existing services and fill in where it's absolutely necessary.
Any other questions?
Homework. So, I don't know if everybody knows who I am, Chris Wisnowski, longtime member of SOMAC. My mother was one of the founding members and deputy chief. What I want to know is, how come this became such a surprise to the community? If you look out on social media and you talk to people around, this was a surprise that you guys had screwed up SOMAC so bad that they had to close it down. Why? For the longest time, SOMAC and this community were like this. What happened? You started chasing transports. You couldn't do calls for people in this community. That's what happened, right? You saw the dollar. You ran after it. You couldn't manage it well enough to make the money off it. And the community lost interest. You lost the heart of the community. I haven't seen any fundraisers. When was the last time SOMAC did a, hey, help us, help you kind of thing? When I was EMS captain in Aurora, which is over in the Finger Lakes, right? Their EMS is part of their fire department. We needed to buy a new ambulance, so we had to do fundraisers. When we had money issues, we did fundraisers for communities. What happened? SOMAC used to do that kind of stuff. SOMAC used to do community things. It wasn't just, a bunch of people on a board and a handful of Colgate students. The community had your back, SOMAC's back, and vice versa. And I think when the community stopped feeling like SOMAC had your back because, oh, we're going to have to call somebody from CVAC for your call because SOMAC's out on a transfer to Albany or worse, right? I think that hurt a lot, right? And now what we're seeing is the government's taking over, right? So thank you very much for dealing with this issue. It's a very good transition of service. That was very good for the community. We definitely needed that. But now you see there's not going to be an investment there, right? Now it's a county service. And I don't think we're going to see the investment from the community like we did before. And that makes me sad because a lot of people in this community put years into that organization.
I'm going to step in here and defend SOMAC because I feel that the issue of volunteerism is not just EMTs and paramedics, it's also board members, right? You need people to serve on boards, and it's not a fun job. And this has happened in many, many communities. They're losing volunteers to serve on boards, so it's hard to get the energy to do a fundraiser. The hospital and SOMAC used to do a fundraiser together. The hospital has its own set of financial problems, and so that they weren't able to work together anymore because there just wasn't the energy on the hospital board to support and work together. So it's kind of a domino effect that's just happened in our community. And maybe you're right, maybe when the town stepped in and started providing the financial support, that made the board relax a little bit, but I don't know what other decision we could have made. And if you recall, we did try to create an ambulance district about 7 or 8 years ago, and we did come to the community and we did tell them that there was a serious financial problem. We were losing, we were transitioning from volunteers to paid staff, and we needed to do something. And at that point, the community said, no, we don't want an ambulance service. You guys voted on it and said, no, you don't want to have an ambulance district. You wanted the towns to continue to provide financial support. So we did that. I can't judge how that impacted those individual board members, but I know that they came to meetings, and I know the board members that are here tonight who have been working on this transition have been working really, really hard to make sure that we make the right choice. That's why we hired Paul, to help us put this whole thing in perspective. So I don't think it's really, I just don't think it's fair to blame. That's why I said I don't believe there's any blame to go around here. It's sad. And I know some of the many people, you know, who made SOMAC a great organization, but times change, you know?
Hi, I'm Ruth Ann Lovelace. I'd just like to make one comment in response to what Chris said. I'm sorry to say that there's probably no one in this room who had to call 911 in SOMAC more times in the past 5 years than I did. They were always there, always. They weren't on transports. We didn't lose service. I would say within 10 minutes, the ambulance was at my house. And I am very, very grateful to the service that they provided. And I feel very confident that that same service will now continue.
On behalf of the hospital too, in terms of transfers, I'd like to respond to that as well. You know, we went through this pandemic, and over the last 2 to 3 years, we have had a shift in the landscape in healthcare, and our hospitals are exploding with patients. And for us to be able to send a patient to our typical locations, such as Syracuse or Utica, oftentimes we were transferring far, far away just because we couldn't find anywhere near or closer for our community members to get the care that they actually needed. And so, yeah, SOMAC was there, and in some cases, they weren't there for us, and we had to reach out to other places too. But I think that it's important for us to recognize that the healthcare landscape has shifted and certainly gone through a very challenging time, trying to ensure that our patients and our community members are getting the care that they need from both SOMAC and the hospital, and then to a higher level of care. So.
One other thing that's changed in EMS is SOMAC has been taking 911 calls further and further away from Hamilton. And the most extreme example that I can give you is that SOMAC was the 911 ambulance responding to a call in New Berlin. So that tells you, those of you who know where New Berlin is, that tells you the state of EMS in New York State. We're not quite at the crisis level, but we're approaching that. And unfortunately, SOMAC is an early victim of the circumstances. Not of anybody's wrong choices, not of anybody's nefarious things. It's just, this is what happened. We tried very hard to keep SOMAC going. We were down to a bare bones budget, but the board voted in September, like we said. It seemed irresponsible. Well, let me take a step backwards. Madison County, at a meeting with our board and our partners at our station, Madison County made a proposal that they would be able to provide the same service, almost completely exactly the same service that SOMAC's provided. And it would be, the cost would be spread out over the entire county, and therefore it'd be less money for the towns that are hurting too. SOMAC's budget, and I always have to ask you for this exact number. SOMAC's request from the town of Lebanon was how much, what was the percentage? 33% of your entire budget, correct? And 33% of their entire general fund budget. So it came to the point where, and town of Hamilton's not that far off, I don't think. So it came to a point where we finally said it's irresponsible for us to ask the towns our staffing level had gotten to the point where we were in crisis. We could no longer hire staff. I mean, yes, there were many, many reasons. Some of the staff had gone to the county because they can make more money at the county, or it works through their retirement or something like that. But others, we had one staff member that left and became full-time at the National Guard. We had one that's gone to nursing school, one paramedic that's becoming a respiratory therapist, and then two of them had left to join the City of Norwich Fire Academy, which was their lifelong plan. That was their dream. So, of course, naturally, these people are making changes, so it's best for them. I can't fault them for that one little bit. But our staffing had gotten to the point where our board chose to say, it's irresponsible. I can't, with the proposal that the county had made, how can we stand up and say to the county and the taxpayers and the town boards and say, no, you should fund us anyway because we're teetering on the edge. We might be able to make it, but we don't know for certain. So we decided at that point it was time to make the tough decision and transfer it to Madison County. And that was a very, very difficult decision to make. And Saturday morning when we transitioned service, I had a tear in my eye, I'll tell you that. And I'm confident the county is sincere in their proposal. The people that are working on it, I've spent many, many hours talking to them about it, and I believe them. I mean, yes, politicians can change and things could change, circumstances could change. The question earlier was, is this the answer? I don't think necessarily this step is the answer, but it's a step towards the answer. I mean, we're not going to get to the answer in one stride, but I think this is a good step. I do also think that, yes, the citizens should keep an eye on what's going on. And if you're not happy with what's going on, say something. Go to your town supervisors and say something. I mean, I believe that they're going to do their best to give you the service that you need, but always keep your eyes open.
So I've got a few things to say and a few things to ask. So I'm Dave Snyder, for those of you who don't know, but I was chief of SOMAC for almost 17 years. So first of all, thank you for Madison County. I have nothing against the county for stepping up and filling the gaps for where SOMAC has failed. The providers of SOMAC were not part of the issue. They have always provided good care. One thing I do have a concern though, we learned in the statistics, the transfers did not work for SOMAC. They lost money. They ran their rigs right into the ground. The maintenance costs went up. If the county is going to be doing transfers, are we going to be leaving the community short? Because he's wrong when it says the community was not covered. I heard on my pager many times when SOMAC was out on transfers, coverage was not available. There's commercial services that can do that work.
So the primary goal of the county EMS service is to provide 911 coverage to the communities. We've been in constant communication with Community Memorial Hospital. We are in the process of putting on a second crew for handling transfers, and the only time we will take a non-emergency transfer is if we do have a second crew in-house at this time. And last night we had an emergent transfer. We had a patient that needed to go to a Syracuse hospital immediately. We did send our full-time ALS crew, and we did call in a crew and have a crew in the station when that other ambulance went to the hospital. So we made sure that there was coverage for the 911 area of this area. That's our primary responsibility. Will we be assisting with the hospital and getting as many transfers out as we can handle? Sure. But we've also reached out to the other agencies around us, like CVAC and Vinyl, to say, hey, we're not going to be able to do all these transfers. Can you help? And they've absolutely stepped up to the plate and said, yes, we can help with those transfers.
Okay. No, and the last thing is communication. And like Chris said, it's sad that the towns didn't let the community members know this was going on, so we could have been part of that solution. You didn't listen to us back when we voted the tax district down. There was reasons for that. It was the leadership, the lack of leadership. The fact that SOMAC, up until the end, that they've killed it, they didn't communicate with the community. They were a 501c3 corporation receiving public tax money. Did they announce their meetings? No. Did they have a board that was a self-electing board? That's why they lost so many members years ago. That's why 20-year members walked away. Because We couldn't talk to the board. We saw what was coming because we had our hands on the pulse of EMS of what was going on. And when we tried to bring that to the past board, they wouldn't hear of it. Oh, we'll dissolve SOMAC before we put on paid staff. And then when they came to the town, they wanted an 800% increase. So these are the things that made it fail. The board of directors that didn't open up and let people know what was going on. The towns that didn't let us know what was going on. So water under the bridge, thank you for Madison County for stepping up. Hopefully we can help and keep things running.
Are there other questions?
I wanted to piggyback off something Luke said earlier about all of us having the opportunity to volunteer. But even if every one of us in this room does go get our EMT card, what volunteer opportunities exist with the county, if any, and if not, where would you direct interested participants?
Right now, the county doesn't have a volunteer program for EMS, although we have integrated the Colgate students into our program. That's not something that we have the capability to do at this point, but it's something that we can look into towards the future. But all of our local fire departments take volunteers, and I'm sure they would be happy to have you. I have three fire chiefs right here in the room that would be very happy to have some volunteer EMS help. We also have plenty of other volunteer organizations. One right around the corner, Madison Fire. They also have an ambulance that they run. They do a great job up there as well, so I'm sure they would be happy to have volunteer help. We also have Greater Lenox Ambulance, which is up in Lenox, up the Wausau, Lenox area. There is, KVAC Ambulance is up in Casanova, and they do a volunteer service, and they do a great job. So there's plenty of volunteer EMS opportunities here in this county, and we would be happy to direct you to any of those services that you'd feel be part of. So we would greatly appreciate the volunteer help in any of the services that you would like to provide.
You brought up the question. By the way, big kudos to the county for picking this up because doing it. So what was different from SOMAC as a volunteer org than all the other successful orgs in the county? Or do I not need to answer that? Hear the answer to that?
I just want to try to lay that out as I started the presentation this evening. This is a challenge for volunteer organizations across the state, across the country. And what happens at each volunteer organization, is dependent on that. But it's not just EMS or fire, right? We're running into this issue with scouts and church organizations and civic organizations. But the difference is if you don't have enough scout leaders, maybe you aren't able to run as many camping trips. But when you don't have enough EMS providers, we need to find that alternative.
Right, but I understand that I've worked in healthcare for about the last 30 years or so. So both on the provider side and on the payer side. My question is, if KVAC can get volunteers and Greater Lenox can get volunteers and other very similar communities can get volunteers in the county, what was the issue with SOMAC? And why did that? You see where I'm going back to you lost your connection with the community when you stopped talking to the community?
I'm not sure what value we're going to get out of this conversation this evening.
The value is that there were changes made and differences between what was going on with SOMAC and what has been going on at other successful volunteer EMS corps in the county. And we need to make sure that we identify those issues and then work to not replicate them in the future as we look at a volunteer system for the county possibly, right? Or maybe even Colgate opening up their own volunteer corps for their students, right? That's my point. Learn from our past mistakes.
So you bring up an excellent point, but comparing one agency to another is like comparing apples to oranges. Every agency is different and unique in their own way. And some agencies have been around longer than others. Some rely heavily on volunteerism, some do not. Everything's a little different in each agency, and we learned that because we brought every single agency to the county board, and we asked every agency, what are you doing right? What are you doing wrong? What can we help with? And every agency had a different answer because every agency is unique and different. And it's hard to pinpoint what one does that the other can't, and what one can and the other doesn't have the capabilities to do. So it's very difficult to say, well, what are you doing right that we're doing wrong? Because everybody's different, and really it's apples to oranges when you compare EMS agencies, even funding mechanisms for EMS agencies, because some people did get more funding from towns and taxpayer money. Some people didn't need as much money because they had a different style of how they ran their agency. So it all depends on different things that each agency does, and comparing apples to oranges is like going to the fruit market and wanting a star fruit when you're in upstate New York, because I can never find a star fruit, and that's my favorite, so.
I would say as an answer to your question is that, A, I don't know what might be different. I don't know how many volunteers KVAC has and CVAC has and so on. I do know that KVAC has signs out front saying they're looking for volunteers. So it may simply be that SOMAC was just first, and that the other agencies, what's the average age of the volunteers at these agencies nowadays? I'll bet you it's pretty high. But I don't know the answer to your question. And as far as during COVID, SOMAC put out a request for volunteers, and we got a lot of people that came that said that they were willing to become drivers. And then not a single one of them actually came, and when we requested for them to come and get trained, 0 of them actually came. I just think volunteerism is down. I mean, I really don't think there's anything about SOMAC that kept volunteers away. People may disagree with that. I understand you may disagree with it, but this is my opinion. I don't think SOMAC had anything that, other than paid personnel, which is a known factor of keeping volunteers away.
So let me respond to that a little bit.
We should go back to the mic and get over
So back to the community tie is what I'm getting back to, right? This community is small. We talk to each other, right? We see each other at sporting events. We see each other at the farmer's market, right? We hear about SOMAC not being able to take a call for a founding member and former deputy chief when they're out doing a transport. So that word gets around, right? And that makes people not want to be part of an organization like that. And that wasn't the first story like that I've heard. So I've moved back here about 2 years ago, year and a half ago, right? The number of people that came to me and said, oh my God, you're not going to believe what's happened to SOMAC. They are not a community organization anymore. They just don't care. They're just tracing transports. And it wasn't people who've already spoken here, so don't worry, all right? It was other people in the community who, oh, hey, Chris, welcome back, welcome home, right? It was stuff like that. Those things get around, guys, and that people don't want to volunteer for organizations that they don't feel have the community's best interest in. If you're especially volunteering, because right now it's impossible to get volunteers. One, we had COVID, right? Nobody wanted to go out and volunteer. And now 2, everybody's just kind of keeping to themselves, and volunteering is a lot of work. And we kind of got into this kind of COVID help, right? This me kind of kind of keep your own little bubble kind of thing, right? People don't want to get into that. So yes, finding volunteers is very hard, but it makes it even harder when all those kind of conversations are going around in a community.
All right, so the policy at SOMAC, we did not take transfers if we did not have a 911 crew available, unless, as I said earlier, unless it was a priority 1 transfer, essentially an emergency transfer out of the hospital. That's a fact. I mean, and we can back that up with our data. So we did not leave 911 uncovered for a routine transfer. Now,
that was no routine transfer. That was an emergency transfer. CDAC took it.
I'm a
founding member of that organization.
Okay, founding member means nothing. That's irrelevant.
It should mean something.
But it can't.
It do it here.
All right, you know what, I was trying to come up with an answer and not turn this into an
You
argument.
failed.
Fine, I failed. Well, whatever. But, one second.
Okay.
But I'm not going to speak to any individual transfer because of privacy laws. It's not going to happen. So we're not going to discuss that. But the fact remains that there are plenty of times where SOMAC was out on a 911 call and a transfer came in, or another 911 call came in. Or they're out on a priority 1 transfer and another 911 call came in. And then we may not have had a crew available. That's a possibility. But we did not do routine transfers if there was no 911 call, no 911 crew available.
I would just like to say that I would really like to stop the whole line of questioning and challenging SOMAC's operations. This is not at this point, it's a moot point, okay? It's over with, all right? And so hindsight is 20/20. You all have hindsight, great, and that's wonderful. But today we're here to talk about the future and what's going to happen in our community and how will it be served. And I really would like to refocus our thoughts and our conversation on those issues. And so if you have issues about how is it going to function, because we're not going to change what happened at this point. Yes, maybe there's some lessons to be learned in communication, but I will say to you that I will say to you at the town of Hamilton, at every single month on our board meeting, we have a report from the liaison, Travis Du Bois, as to the status of the SOMAC situation. It's right out there. Anybody who wanted to come to our meetings, Zoom or in person, could have attended and asked questions. I don't remember the last time anyone has come to the meeting to ask questions about SOMAC, but it's right there. So it's not that we're not communicating, it's that no one is listening or asking questions and coming to meetings. That has also happened in the last 5 years. People just don't show up. They don't come to meetings either. They don't care what's going on. It's like, okay, somebody else is going to take care of it. So, and that's kind of what's happened. So. Yeah, sure. Yeah, and there's actual town board members. So Greg and Travis are actually serving on the SOMAC board, and they have been there and doing their best, working with other board members to come up with solutions and to the problems and the challenges. But I think the organizations that really have a robust volunteer core, they also have more volume. There's more people there. There's more volunteers, and there's more calls. It helps them be healthier. And some of them have ambulance districts, taxing districts. That also helps them, right? So there's so many factors, as Jenna said, apples and oranges. But we'll take some more questions, but I hope...
Well, I have no questions. I just want to make a statement.
Okay, I hope it's a positive.
You stopped when you should have. I'm Linda Cadwell, and I've been a member since 1993. And I told Morgan last Saturday morning that I'm still willing to drive, and that's all I ever did with SOMAC from 1991 on to present, until you just dissolved it. And it kind of upsets me because you keep saying, well, volunteers. Nobody wants to volunteer anymore because they're afraid they're going to be sued. Some of these people, that's what happens. Something goes wrong, Chris gets hurt, we go over to help him, well, we could be sued. I go over to help Chris, and just because I'm a friend, he could come turn around and sue me. I think this is what happened to a lot of the people that have volunteered. And unfortunately, the paid staff that was there, I don't know how many times I called and says, I'll take the drive if you want me to go. I'll go. Oh, we got it covered by now. And they had 2 minutes before that, they had just put out the call. And you can't say somebody, paid crew, somebody else beat me to it. Nah. And I mean, I had a business here in Hamilton, and that's when SOMAC got called, guess who went to drive? So, I mean, it's just a statement. Take it as you want. Thank you.
Thank you.
Good evening. I promised I wasn't going to say anything tonight, but 37 years ago, 4 guys sat over at the Colgate Inn. Came up with a good idea. I think it worked pretty well. I had the opportunity, and I was blessed with the opportunity to start this court. I did all the training, drove, worked in the back, did everything for years, and I loved every single minute. I can't tell you the number of lives that we have touched in a most positive fashion doing what we've done. I've been in healthcare all my life. I've been out of medicine now for the last few years. I retired. Thank God I retired. Healthcare today is not a friendly environment. It is not. And this is only one small little tiny thorn in a dying rose bush. Because healthcare was years ago, it was everybody's vision to be part of healthcare. That was a career that would get you everything. Not so much anymore, and that's sad, but that's nothing that we can fix here. That's nothing we can, being cognizant of that fact is probably the best thing that we could do, and understand that there's just nothing that's going to be perfect. But I'm going to tell you, I've always been so proud of this corps. And I've missed it. And I'll always miss it. But you know, a little choked up now, but when I drive out of here, I'll be smiling. Because we made a difference. Anybody who ever got in the back of that ambulance made a difference. So, please, just remember, if you want to do something good, this is a good business to be in, but it's got its pitfalls. But I can't thank, and I got to go back to that first day. With Bob Kuiper, Dave Felton, myself, and God, you remember Tom Gilpatrick? He used to be the director of Colgate Inn. The 4 of us, we're the ones that sat down and decided this would be a good thing for this town. Earlier, I didn't know if I was right, but you know what? I've never been more right. So, thank you, and thank you.
Sam? More questions? Great. This man has lots of questions. He keeps the conversation going in Hamilton.
Well, Sam Cooper from Hamilton. You know, hindsight is right. We can look back at the mistakes.
We can't hear you, Sam, if you don't. We can hear you, but...
Hindsight
Thank you.
is the right thing to do. We can look back at who made what decision when. But I can't substitute my judgment for a group of people who've been studying this for a year, brought in an outside consultant for another opinion or 2. Well, what I am concerned is, in the year 2028, 5 years from now, what will our ambulance service look like 5 years from now? Because that's, everything up to this point is in the past. Now we got to look at a 5-year plan and say, how do we make sure, one, we understood the mistakes in the past and we don't repeat them, but 2, how do we provide the services this community is going to need for the next 5 years? So I have some questions. There's some people in the audience from the university, and I'm sure they're wondering about the role of the volunteers from Colgate. You alluded to they would be under the umbrella of the county. Can you share with us what the next 5 years will look like for those volunteers from Colgate What can they or what will they not be allowed to do? I'm going to give you about 3 questions, and anybody can take it and answer them. I understand that Lebanon can't handle 30% of their budget or so just for one service. They just don't have the base. And I understand the town of Hamilton just can't keep pouring more money into it. And so, you're right. The economy of scale will be helpful. Yes, you're right. You will be able to retain or attract more EMTs. The question, however, is if both Lebanon and Earlville and Hamilton budgets don't have to absorb this high expense, what does that mean for the taxpayers here? Obviously, that fund of money could be used for other purposes. I'll let you decide what those other purposes are. Evan, you're very confident that losing a board made up of local people can be accommodated by turning to the county board of supervisors. What makes you feel so confident that you would make that recommendation when you know that Hamilton and Earlville and Lebanon are the smaller communities in the county and they have weighted representation? Why do you feel we'll be able to have quality service with appropriate funding when we may not have sufficient support from the larger entity? But you're confident, and I just want to know why you're so confident.
Wait,
I'll stop.
hold on, just, let's go in order. So go ahead, Jenna. So, you asked the questions about the Colgate students. We are so excited to bring on the Colgate students to our program because they bring a new light to us. For those of you who have been in EMS for many years, you realize that sometimes you have some dark days. And these Colgate students bring a light to us like no other. In the very few months that we've been working with them, they have made us kind of fall in love with EMS again because they have such a bright future and they have so many wants and so many needs and they just want to get out there and they want to do the calls and they want to help the community. So we want to be able to provide them that structure in order for them to be able to do that. We've actually customized their uniform shirts with the Colgate colors and a Colgate C on them, but they say Madison County. So you know that when they come to your house to give you good service, that they're Colgate students that are giving back to this community. We are starting to make some changes to their program so they can drive more efficiently, so that they can provide better patient care, and they are so excited to work with us, and we are very excited to work with them. They have expressed very, very much that they love SOMAC and they are going to miss SOMAC, but they are also very excited to start working with the county. And we are so excited to have them. So we look forward to bringing them under our umbrella, and we look forward to the next 5 years with them, because all I can see is growth from this program. Okay, so Sam, I'm going to tackle the first question, which is why am I confident that the county service, first of all, will adapt and be able to serve the needs of our community as well as other communities. There are 2 people here, Jenna's one of them, and Dan is right here. Dan DeGear is the head of the emergency management, the overall agency or department in the county. And Dan was also a supervisor from the town of DeRuyter for many years. So when I was first on the board, Dan was the vice chair of the board, so I know him pretty well. And I watched him transition from being a board member to being a dedicated public servant in a paid public servant in a different way than being a supervisor, which is, it's a political position. Dan found his calling. So clear to me. He's such a happy man now that he's doing, I know that seems crazy, but it's really true. Dan is happy because he loves the challenge of preparing Madison County for emergencies like, tornadoes and floods and, just he gets up in the morning, he wants to do that. And when the community, it became clear that the emergency medical service was also beginning to really falter, and Dan is very well aware of that coming from DeRuyter, where they're served by a single gentleman who runs a private service, and I know he's older than I am, that's all I can tell you. I don't know how old he is, but I'm gonna be 70 next week. He's older than I am, so he's, you know, so Dan's community is still dependent on a single provider. And so that made him nervous. He was very aware of that when he took the job, and it's only, you know, it's only gotten clear that yes, the other ambulance services are doing okay, but they all have their challenges. So I am very confident because of these two people and the people that they've hired. Tom's here, another assistant, you know, I don't know what I forgot what your title is, Tom, but Tom's right, deputy director. They're enthusiastic, they care, they're moral, they work really, really hard. What they have done in this community in the last 2 months to meet the service and the needs, we were supposed to be starting, we, meaning the county, as my husband tells me, which we are you talking about, the town or the county? The county has come up to the challenge. It was only November 10th, and they're able to provide that service. That tells me that they're not going to stop until they get the job done. So I have a lot of confidence in those two, in that department. They're fantastic. Okay, now let me deal with the political side of this, okay? As Luke said, it's been a lot of years of work on this issue. It's been 2 or 3 years of political discussions and board meetings and committee meetings, the Public Service Committee, hashing this over. We commissioned a study how many years ago? So the fish studies? 7? Yeah, okay, so 8 years ago. And that told our county exactly what was going to happen, and lo and behold, all these things that they predicted have happened in our county, including the failure of a couple of departments. You know, the handwriting was on the wall, but the county was like, we don't want to deal with this. You know, it's like, oh, that's too hard. But when we had someone in our county emergency service that was prepared to take on the challenge, then Dan began to provide service ideas about how we might do that. He went and met with other communities, went to other counties and found out how they're dealing with the service. And I think that he educated the board. He brought the board members along so that we had members from the city of Edina who, you know, they represent the city of Edina. They have a private service that covers them. They have a lot of residents. They don't have a great payer mix. But they're the guy's making money, he's smiling, he's going on vacation, the guy that owns the business, right? So there are differences, but they understand that at sometime in the future, their community might need the services of Madison County. So there's been no pushback. The resolutions to provide additional financial support have been absolutely unanimous. Doesn't matter that I don't have as many votes. Everyone understands, and that's the good job that Dan has done and the Public Service Committee. There's no members here tonight, they all had different obligations, but, oh, I'm sorry, who's here? Pete, are you here? Supervisor from the town of Georgetown, Pete Walrod. He's been instrumental in educating the other board members, and, sorry, you're in the dark, Pete, I can't see you. There's no light back there. But, you know, there's just a lot of very dedicated people who care about this and want to make sure that this continues in our community through the whole county. And it's all for one and one for all. We realize that. And, you know, the first service happened in the town of Sullivan, one of the larger towns that has a strong financial base, but they were being served by a private company that wasn't doing a good job. They're only getting about 60% of the calls. So they chose to go with the county to support the creation of a countywide service because they realized it was the right thing to do. So, and that really helped open up everybody's mind in the whole county and the Board of Supervisors to understand it. So that's why I'm confident, because I know the people. I've been your supervisor for the last 12 years. I know how people make decisions, and we put politics aside and we just work for the betterment of the whole community. So I'm not worried. Believe me, when I'm no longer supervisor and if they mess up, I'll be there. I'll be going to the meetings. Yep.
I just want to add to that because Yeah, I know Dan and Jen maybe over the last year. I've gotten to know them, knew of them, but didn't know what they had their hands in. I think that for me, what made me confident is their plans to recruit and retain professionals in the EMS practice, and their dedication and their planning efforts to have a training center and be able to have the resources to put into the training of a competent EMS service. And so for me, and the population that I serve at the hospital, I'm also on the SOMAC board, I'm also a community member, a long-term community member. So, you know, my neighbors are up there, and most of you are my neighbors, but you know, the concern was there, could they potentially continue this service for the next 5 years? When I sat and listened to them talk about what their plans were, you know, that gave me the confidence and knowing that they were going to put in the efforts to long-term retain and retrain people moving forward. So I think that for me, that was really what sold me on the confidence in the next 5 years.
I thought we got all your questions.
Not a question, this is a statement. Listening to what you all just said makes sense. But Dan's not going to be here forever, and people change. And you folks may not be in the positions you're in, and things will change. How have you thought about codifying what you said tonight so that when the individuals no longer are on that board, when you're no longer in the position of authority, that what you described tonight will be there in 2028? Have you thought about codifying any of this so that the Board of Supervisors is obligated? We've seen, without that strength and structure, 50-year precedents have changed overnight. We need to know for the next 5 years or 10 years, this is going to be better. And this is how we're going to assure it.
Yep, sure.
So I'd say one of the things that gave me confidence was, it's been mentioned here that, I don't remember exactly when it happened, but the county passed a resolution, I said it earlier too, saying that EMS is an essential service. Have any other counties in New York done that? I'm not sure they have. They have? Okay, they have. So, but I don't know what weight that particular resolution has in the future, but it set the tone for the county. And that was an important piece in the puzzle for me, the sincerity of the people presenting their plan, et cetera, but that was an important piece. That meant that the county supervisors, the Board of Supervisors, as a unit, and I was told it was unanimous, as a unit felt that EMS is in fact an essential service, and that it was much more likely to remain that way because that resolution had passed.
And I would just add that we've also started the process of trying to pass New York State legislation to make EMS an essential service in New York State. Right now, fire is. So every town is obligated to provide and support the fire service, but we are not obligated to provide EMS service. So that we believe that by changing it fundamentally with New York State law, that will help. I think that will cement the legal framework, Sam. I haven't thought about it in terms of a different scenario for Madison County, but it's a good question, and maybe we'll, I'll pick Mark Simone's brain about this. We'll talk to the county attorney. Maybe there is something, I don't know, maybe there's some mechanism that we can pass beyond this. But I think I think you all have to stay active, frankly. Citizens have to stay active. They have to make us accountable, and that's your job. So I think that's also really important. If this service is important to you, you need, if if you all could send a letter or an email to the County Board of Supervisors thanking them for stepping up for Hamilton and Lebanon, that would be awesome, because people like to be thanked for their work and to understand that they stretched a little bit to do this, right? They did. And so I think, you know, that plus being aware and conscious and paying attention, as, you know, I think Paul said, we need to hold the county service accountable. And the towns of Lebanon and the town of Hamilton will do that, absolutely. We'll be looking at the metrics, and there'll be reports, and the Public Service Committee will be, the Public Safety Committee, excuse me, will be looking at the service, and we look at the budget, and we look at the finances. So it's a pretty transparent operation up there. And y'all are welcome, you know, all those meetings are open to the public. So find out, talk to Sam, our public information officer, about when those meetings, but that's all posted. The schedule of Public Safety Committee meetings is on the website for the county. You can attend, you can, you know, if you want to attend by Zoom, you can do that.
Clarifying, public safety or health department, who is the department, or what is the department at the county level that will oversee this project?
The Public Safety Committee is the committee that oversees emergency management. And emergency management is the umbrella that covers 911 and fire service and emergency medical. And what did I leave off?
But it's not the health department.
Emergency management, yeah.
But it's not the health department.
Right, no, it's not the health department. Please, Pete, add your voice.
My name's Pete Walrod. I'm supervisor of the town of Georgetown. I was late. I'm still in my work clothes, but I wanted to get here. T-Van's done a nice job of articulating the thoughts, but a couple thoughts as I listen to this is, you know, my town, Georgetown, is the smallest town in the county. I have 15 votes, and the next closest, I think, is 26. So Evan has 144 votes, so really not the smallest town in the county. But it's not the votes, it's the voice. And as we've taken this, you know, I've been on that. Criminal justice, public safety is the actual term of that committee that oversees this. And, you know, I started just serving my community up there, and I was appointed on that committee. Dan was the chair of that committee at the time. I moved up, I was the vice chair of that committee, then I was the chair of that committee throughout a lot of this, the study, you know, after the study and all this came about. And I didn't have the votes to sway anybody, but we knew it was the right thing. We could see the direction this was going. And I don't want you to feel isolated in any community, because when we serve on that board of supervisors, sincerely, we look at Madison County as the community. There's one community here that we're serving. And when we work together and articulate our needs in that county, there's the supervisors of larger towns step up and they support. You know, be it Casanova or whatever, they have, you know, even more votes than Evan. But, you know, that feeling is definitely there. And that feeling of support and community, but that's something I'd like to make sure to try to convey to you folks. And definitely, there is no guarantees in 5 years, 3 years. Nobody's making promises for that. But when I came on that board, I had no knowledge. I didn't even realize in my own town that the town government owned the ambulance. It was housed at the fire department. I thought the fire department owned the ambulance. We paid taxes to the fire department. That was an education in itself. So that's how naive I was to the workings of this. But when you're engaged and you care, you develop that education, you try to get that education. But as far as any guarantees there isn't, all we can promise is that the people that come on board in the future generations, when Evan and I aren't there and the other people that are there today, that they'll receive that education ongoing from those, we mentor those new members, that these department heads still care. You know, John wasn't here, Tom Dorn wasn't here, even Sam's position wasn't here. We continue to improve on that county, and we're proud of that county, and I hope you are too. And this is just one segment of it, and I'm happy to be here. I'm happy to see the support there is for the county, and I know how much Morgan, I went to those meetings. I know how much commitment and what commitment this board gave to your community. And, you know, the providers have been here through the years. It's really telling. And but as a board of supervisor, member, I just want to say there's no guarantees, but we will be committed to making sure this carries forward. That's all we can say. Thank you.
One last question, Chris.
It's a future, forward-thinking question. What else can we do to help? What else can we as a community do to help? You mentioned send some thank you notes to the county, right? No, it makes sense, right? People love thank you notes, right? That makes sense. It puts it in their head. Yeah, Hamilton appreciates this, right? Hamilton, Lebanon, all of us, right? What else can we do? Is there? I mean, you're still kind of figuring out the volunteer thing, so we'll see there. But I mean, do we need a big membership push? Do we need a big?
Yeah, right now there's a direct pay bill in government right now. It's been passed by both houses. It is waiting for the governor to call it up to her desk to sign it.
So we should all write Kathy a nasty gram and say, sign the darn thing?
Yep, sign the direct pay bill, because that will make the insurance companies give money directly to the ambulance agency versus sending insurance checks to patients. Because when we do that, that'll make ambulance agencies across New York State more sustainable. The other thing is, once we get the legislation forward on making EMS essential, we are going to need your help to get that passed in Albany. We are going to need to make EMS an essential service, because it is.
Well, and we need to make sure it's not an unfunded mandate, right? We don't want it to tell all of the towns now, you have to pay for EMS service, and not the state figure out how we're going to pay for it.
Right, and it did go to Albany before. It did get turned down because of that, and it is going back again with new wording and new legislation. So we're very excited that this is also moving forward. The other thing, get your CPR card. Take CPR training, which the county can offer to you, and that makes you much more valuable to your area and your community, because if you need CPR, if somebody needs CPR, you can help them. Help us help you.
Where can we get our CPR cards nowadays?
We do have an EMS education program through our county website, and there are links on that website that lets you reach out to our full-time EMS educator for requests for CPR classes. We're going to start doing them at fire departments, and we're going to start doing them all around different communities. So I'm sure if we ask Chief Marks if we can host a CPR class to the public at Hamilton Fire Station, I'm sure he wouldn't object. Sorry, Brian, didn't mean for John's mind.
We used to do community classes at SOMAC as well.
So it's Assembly Bill 250, and it let the governor's office know. It's through both the House and the Senate, but it's the governor. She needs to sign it. She has 8 days left. And then, to piggyback on that, there's an awful lot of gray hair in the room and coming in here as well. We need a new generation in EMS. And, when you have people in your lives who you can encourage to take an EMT class, we will welcome them with open arms and encourage them. Even if we only have them for a handful of years before they move on to something else, it's a great start and a wonderful exposure to healthcare.
Like we said earlier, there's a class starting in January in Hubbardton?
Yeah.
Jen and Tom are teaching it.
Me and Tom are actually the instructors of that class. So
All right.
Sign up. It's on the Mid-State EMS website.
It's been a long time since I took my first EMT class. Thank you.
Sure.
Just a quick one. Hi, I'm Mary Rodden. I used to be a nurse practitioner. I did volunteer for SOMAC for a while until COVID, but my kids were like, no, you can't do it anymore. But my questions from the community that I keep hearing is, where is the ambulance going to be parked? Are we going to still have a team down there? I'm hearing it's going to still be in the same garage, and they're going to keep a team right there so that when you call 911, how long is it going to take to get somebody out to wherever they have to go?
So currently we do have our full-time staff at the station, at the same exact SOMAC location at 86 Lebanon Street. We are working closely with the SOMAC board to be able to remain in that building, do some renovations and some upkeep. And yes, that is our plan, to operate solely out of that building so we can still maintain a really good shoot time and a really good response time to your emergency in this area.
We even take questions from other towns.
Other towns.
Mayor Easton.
I'm Bill Acey, Mayor of the Village of Sherburne, and we grapple with these same issues every day and have been for many, many years, just like you all have. We have a saying that EMS sucks the oxygen out of the room every day because it's a difficult challenge every day. My question is about intercounty and mutual aid. So Mac, guys, thank you. We've seen your ambulance in Sherburne many times and we appreciate it. But I also just want to make a comment too. I'll throw that question out about the intercounty. But we're lucky to have Paul here. I've been reading about Paul. Paul's done plans for several counties, and I would applaud this group, especially for getting ahead of the issue and being ready when SOMAC had its issues and being prepared. And we're starting to see the same things happen that you have seen. We are where you are. We are where you were, say, 8 to 10 months ago. So we're in that same crisis mode, and we're not sure what we're going to do. But I hope that we can come out and have the same solution that you did. My hat's off to all of you. I think you've done a great job. So thank you.
So the intercounty mutual aid, we do have a county mutual aid program that all the EMS agencies sign. And the one thing about the county program that's a little different is we do have a fly car. That is, we have 2 fly cars, one's north, one's south. So a fly car is a SUV vehicle with staff with a paramedic and EMT. And they roam around the county all day long or throughout the hours that they're on shift. And they're available at the ALS level, so the advanced life support level, for anyone that actually needs them. So whether that be a link up with a BLS ambulance that they need a paramedic, or whether it be that primary agency has all of its ambulances out on calls, we'll go hang out in that area and do first response for that patient so they have a faster level of ALS care. So our intermunicipal or our mutual aid agreement throughout the county is the closest and appropriate ALS unit if it's needed. So sometimes it's only a fly car and then we send that unit. Sometimes it is a full ALS ambulance. So it's based on the EMD recommendations and it's based on the PSAP of the County 911 Center. So we are very vested in the mutual aid plan in Madison County, and all the agencies participate in making that plan a success. And we've also had a Madison County ambulance in Sherburne a few times because one of the times I've been on it. And we look forward to continuing that relationship with Sherburne in the future.
Okay, I think maybe we've answered every question as possible. So thank you so much for coming this evening, and stay involved. And we will post the information about the bill so you can, we don't have many days left, so let's get to the governor and let's really try to get that direct pay bill signed by her. So that would be really, really helpful. Thank you so much for coming this evening. And don't hesitate to reach out to any of us in the future. You can find our names on various town sites and hospitals and whatever. But please don't hesitate. If you get home and you have another question, give us a call or send us an email. Thank you.